what is the best approach already using a Bifrost system? Would you like to make a comment?
Okay, let's talk about hyperacusis. Hyperacusis in Meniere's disease is not really hyperacusis. Hyperacusis, let's say, is hypersensitivity to sound. So patients with Meniere's disease have sensitivity to sound because they have a damage to the cochlea, and the damage to the cochlea causes a phenomenon called recruitment, and recruitment makes you perceive loud sounds louder than they really are. So some people get a bit confused. They think that is hyperacusis. So, but that can be addressed with hearing aids, because hearing aids do have, we can play with the dynamic range of the hearing aid to make loud sounds comfortable. And another thing that happens over time, you desensitize like anything else. So sound that sounded pretty loud to start with over time becomes normalized. So another point to be very careful with patients with Meniere's disease, and I have seen that so many times, people tend to overprotect the affected side. So you say have Meniere's in one side and you feel that sensitivity to sound, people start to be overprotective of that ear. So they start wearing earplugs, they start covering the ear in situations when it's not appropriate. Of course, you need to wear earplugs. Earplugs are important if you're going to a loud concert. Earplugs are important if you're using a power tool. That applies to anybody with normal hearing or hearing loss. But when you have Meniere's disease, you do not wear earplugs just because you want to protect that side. You don't sleep with earplugs. That is the worst thing you can do, because the more you protect your ear, the more sensitive your brain becomes to sound. It's a little bit like wearing sunglasses indoors. If you do that, or if you live in a dark room, when you go out in bright sunlight, you can't tolerate the light. But the brain is clever at adjusting. So if you think you have hyperacusis, the best thing to do is to start exposing your ear gradually to sound. But if you have Meniere's disease, I can bet my bottom dollar that you do not have hyperacusis. Hyperacusis really is a central phenomenon. That's the brain problem. It's not an ear problem. And Meniere's do not have a brain problem. Meniere's is an ear problem.